Hello, good evening, guys. I am Dr. Sanjay Solanke from Homeopathy for Humanity, and here we have Tikwa Sassoon from Israel. She is my partner, and today we will be continuing the next part of characteristics value of symptom from Bönninghausen. So I will hand over to Tikwa.
Hi guys, this is Tikva. So we are continuing today with Bönninghausen, his lesser writings. He has a lot of marvelous essays written in here. And we are going through the essay today called A Contribution to the Judgment Concerning the Characteristic Value of Symptoms. And this is part 2. And we'll just do a quick review. The Bönninghausen says that he put together he propositioned a prize after a congress held in Brussels, and nobody put forth any contributions toward the prize for what makes something characteristic. And so he decided that he'll just do it himself if we don't mind. And of course, we don't mind because he wrote it in an essay and it was published in a booklet. And now we know what he had to say on the topic. So he says that, of course, it belongs to paragraph 153 in the organon, and it belongs to aphorism 86 in the organon. And then he talks about how he wanted to make something that would jog the memory of homeopaths when they are sitting with their patients of what needs to be done. So he looked far and wide at various different medieval and earlier things. And he came up with a hexameter. And this one came from religion about moral disease. And the verse is, Quis quid ubi quibus auxilius cur commodo quando. Now this goes with a snappy tune, but since my Latin isn't good enough, I can't do the snappy tune. So we did quiz who and quid what last week. Today we start with ubi, where.
How to pronounce that?
Ubi.
Who? Yeah. You.
UBI. Ubi.
Ooh. Ubi.
Ubi. There you go. Good job.
Okay.
So that is where. Because
where means, is it a site of disease?
Yeah, the seat of disease.
Yeah.
Because when we know the seat of disease, we can push aside the remedies that do not include that location. Therefore, as we go through each of these things in our analysis and we look at the symptomology, we can thrust aside all the remedies that don't belong to the momenta. He uses the word momenta a lot, which is an interesting way to phrase symptoms. Instead of saying symptoms, he frequently uses the word momenta. Momenta is like movement, momentum, the things that are occurring in the patient.
Yeah.
So he doesn't use that dry word symptom, he uses the word momenta. And so he's looking at the various momenta, the different situations, because it's more situations as opposed to, just like things like pathology, dry pathology. We're going to get into here some interesting things.
Momenta sounds to me more like actually the whole the whole picture, the whole
Yes,
case. More,
exactly. Yes.
I like that. Mhm.
Yeah, so the momenta is a nice word for it.
A
Okay.
portrait. A portrait. Right?
Yes, yes.
The portrait of. Right.
Okay, so you want to pull that up, Ubi, there on page 110, Sanjay, please?
Yeah. Okay. Here you go.
Okay, but since I am sitting at this small screen, I can't see the letters properly from here. So I have
Shall
to,
I try to make enlarge?
it's really that I need new glasses or somebody that can actually cure my vision problem. No, I have my book.
We can go. Okay.
But then I can't see the people. The people are in the way. So we don't need to, I'm just gonna use my book. It's just easier. I can see better
Okay.
with
This
my
one?
book. I have my book there. Okay, so we were talking about diagnostic tools and the pathology.
दरवाजा बंद कर. ती राधिका नहीं, ती दूसरी राधिका. Here we have my daughter.
Hi, Sakshi.
Hi.
Happy birthday.
Thank you.
Happy birthday.
Thank you.
राधिका तुझी ओळख आहे ना?
हो, आता
आम्हाला दुपारीच ओळखलं म्हणजे बोलणं झालं आम्ही लॉजिक शिकलो.
Okay.
Happy birthday.
Thank you.
Okay, you can continue.
All right, so Ubi. The seed of the disease really makes a
Right,
part
right.
of the former question, but it nevertheless deserves to be more particularly emphasized as it frequently furnishes a characteristic symptom, since almost every medicine acts more or less, also more decidedly, on certain particular parts of the living organism. These differences not only enter into consideration in certain so-called, remember he says so-called, local diseases, but also in those diseases which are called by more general names affecting the whole body. For example, gout and rheumatism. For it is probably never or very rarely the case that all parts of the body are affected to the same degree. So even when somebody has said gout or said rheumatism, they might have said rheumatism of the knees more than the elbows, or they will have said gout of the big toe as opposed to the fingers.
A big toe.
Even if it should be merely the case of the right side being more affected than the left or reverse. This helps make something more characteristic, the side. But the examination of the parts affected is most necessary and most required when the whole of which they belong is larger and is described merely in the general way which allopaths seem to delight in. Such names as headache, eye ache, toothache, colic, and the like can in no way contribute to a rational choice of a remedy, not even when the type of pain is indicated. So even if we say, if a patient comes to us and says they have a throbbing headache, that is not enough. We have to qualify and quantify more about the peculiarity of that headache. For example, the right side versus the left side, the back versus the front. So it's not enough to even say headache that's throbbing, headache that's stabbing. We need to have more information than that. Of course, the exact individualization of the UBI, the seat of disease, is most necessary in local ailments. Every homeopath knows from experience how necessary it is, for example, in treating toothache, to select a remedy which, in accordance to its provings on healthy persons, has shown its action on the special tooth to be treated. So if somebody comes to us and says that they have a toothache, we need to know not only like upper right, but we can also sometimes, know that if it's the eye tooth, like ammonium carb has a particular affinity for the eye tooth, and so on. Among the most striking and decisive phenomena in this respect, we should especially remember the sores on the upper side of the joints of fingers and toes, which under allopathic treatment frequently prove very obstinate and not infrequently become malignant and necessitate an amputation. And as I have opportunity of witnessing here in 2 cases, may even have a fatal result. Has anybody encountered anybody that has sores on the top of the joints in their practice in this day and age?
Tops of the finger joints?
Yeah, like for example, like here,
Sure,
yes,
sure, yeah.
okay.
Small joints.
Okay. So Bönninghausen saying here that oftentimes those will go bad, those sores, and they will remove the fingers of people that have those sores. Okay, now he says, every homeopath knows the efficacy of sepia in these ulcers of the joints, which have
Ulcers.
no ulcers of the joints,
Mm-hmm.
which have no otherwise distinguishable features. When this remedy is taken internally, without any external medication, it will have a sure effect. Medicines which correspond to similar ulcers on other parts of the body, in such cases, are utterly useless. So if you ever have a patient that has sores on the tops of their joints, their small joints, we know that sepia is a remedy to look at for that. And of course, no external medication.
Yeah.
Okay, so now we're going to start going into asculation and percussion, the use of the stethoscope and the plesimeter. The plesimeter is an old-fashioned tool. Has anybody ever seen a plesimeter?
No.
No.
Auscultation we have in good stethoscope. Only this thing.
Mm-hmm. Yeah, the plesimeter is an old-fashioned tool that I've never seen in use. Okay, so being able to tap people and different things like that, it falls under the percussion. Okay, let's say we want to find out what's happening in somebody's chest. There's a little device that's made out of like metal or horn or wood that is placed on top of the body part, and then there will be tapping on
Percussion.
that piece. Yes, but they use this thing called a plesimeter on top of the body. See, it's important to be able to know how to do these things so that we don't have to rely on things like CAT scans and x-rays all the time. Okay, so asculation, the practice of asculation and percussion. So then we know where things are in the lungs and stuff like that. So we should all have like a basic fundamental knowledge of this kind of skill so that we know what location a symptom is in. Okay, had it be as well known to Hahnemann and his pupils as it is to our younger physicians, they would no doubt have made the most extended use of the same for gaining a more exact knowledge and delimitation of interior ailments. Okay, the word delimitation means putting parameters, the parameters of the disease. So if somebody has an infection in their lungs, you can find the parameters of the disease, not just by taking an x-ray, but by doing percussion and, with the different sounds that the chest makes. Okay, so here Bönninghausen saying that this is very helpful. And he continues with, okay, the delimitation. The delimitation, remember, that is the area that the illness is in. The limitations kind of thing, to make a line around, that's kind of what delimitation means. Okay, they would have found out in lung troubles, for example, definite local signs pointing to the use of certain remedies and would have indicated them more accurately and would not have limited themselves to defining them as being on the left or the right side or at the top or below. For example, we have a lot of, we have in our repertories, we have left lung, right lung, top of lung, bottom of the lung, right, guys? So if we have more information, that helps narrow our field under analysis. Okay, to bring up to date and to specify more closely might be one of the chief duties of those who make additional provings at the present time, and might serve to an important and essential enrichment and completion of our materia medica more than a whole mass of confirmations of older symptoms or finding out of new ones, which mostly have a lack of individuality. So here he's saying that when we undertake new provings, what we should do is we should try to delineate what part of the body is involved in a more exact way now that we have better tools. And that would complete our materia medica much better than confirming old symptoms or finding out new ones that mostly have a lack of individuality. There's a lot of general that goes into proving data, as we've seen. When we look at our
And local symptom.
Sunday night classes, right? Don't we go through that during our Sunday night classes?
Yeah.
Okay, so Bönninghausen's all like, okay, guys, when you go to do provings again, make a point of finding out more in the UBI, in the seat of disease, in the location, because we need that more than confirming symptoms. Okay.
1 minute. She is going because she need to pack. She is leaving for college tomorrow.
Bye, Sakshi.
Bye, auntie.
Bye-bye.
Bye, madam.
Bye.
Is she studying strict Hahnemannian homeopathy?
No.
Oh,
She
no.
is in college right now. She
Okay.
is homeopathic school.
Okay.
3 more years she has to complete.
Nice.
And I don't think there is a strict Condominium college in all of India. Anyway, yeah, so she's going to have a lot of stuff that she's going to need to sort through in order to figure out where to go and what to do. Put it that way. At the same time, it will be conceded from the allopathic side that the closer delimitation of the part affected, even though it may be of moment in the completion of the diagnosis, will be of no use to allopathic therapy because this school is unacquainted with the peculiarities of the various medicines. No allopathic materia medica gives us any information that any one remedy corresponds more to the anterior or to the posterior lobe of the liver, more to the upper or the lower part of the lungs, on the right or the left side, according to which choice the remedy may be made. So yeah, when somebody gets their inhaler of steroids, the allopath doesn't care which lung's affected, whether it's the top of the lung or the bottom of the lung or anything, right? They just name it, tame it, blame it. That's basically what allopathy does. So they're not looking for the peculiarities or the particularities like a homeopath is. It is invaluable for the homeopath to know various things like upper lobe, lower lobe, bottom, top, etc., 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 right? Hence, it may be seen that these new inventions, the value of which I am not in any way inclined to undervalue, have far less value in a therapeutic direction than in prognosis, where they show the extent and the dangerous nature of the malady. Okay, so he thinks that they have value, but it doesn't give us enough value to, to make a diagnosis on or to give a remedy on, because we need a whole lot more information. Finally, we must yet consider in this question that neither the internal changes, which can be determined by these instruments, nor the material external changes, which manifest themselves openly to our notice, ever present the dynamic disease itself, but are only its products and are only developed in the course of the disease. Okay, this is something that I was trying to bring up as a topic in the group about by the time something has happened pathologically in our patient, by the time there's cysts in the ovaries, by the time there's other, gastropathology, by the time that happens, a lot has happened in the disease already. We've already gone to a point in the disease that where these material changes have happened, because the disease that is dynamic in itself has already been there working for some time on the organism. So by the
I
time,
responded to that question.
yes, you did. Thank you, Devera.
Makes
so
a
we
lot of
wanna-
sense what you're saying, yes.
Yeah, we want to get to disease. Boger has a beautiful quote about how we haven't done our job as homeopaths. If we have a patient that comes down with tuberculosis, if our patient comes down with some kind of chronic disease, if they get cancer, that means that we haven't done our jobs because those pathologies have set in. So that means that we've only been treating our patient in a very superficial way. And I have something to say on this matter. I noticed today while scrolling my Facebook that there is a well-known homeopath that is getting a hip replacement today. Now just think, if proper care had been attended to with the antisporic remedies and whatnot, instead of using homeopathy in a superficial way, like in an allopathic kind of way of, okay, we have a cold, let's take care of the cold. We have an injury, let's take care of injury. If we were to go in for the deeper treatment that needs to be done, wouldn't that hip replacement not have been needed over the course of 40 years of using homeopathy?
Absolutely.
Yes, it's an important question to ask ourselves. Where are we going wrong in teaching the students of today about the necessity of looking at the bigger picture and treating deeply in order to prevent dangerous pathological changes? And if somebody has had the benefit of a lifetime of homeopathy, then doesn't bode well that we have patients that come down with severe symptomology that is not acute. Anyway, back to the topic at hand, which is also the topic I was talking about. Where was I? At the same time, it will be conceded from the, oh, we did that. Okay, no.
I have a mark on the screen.
I know, I was reading from my book again because I have the vision thing, When therefore these first beginnings are checked by the suitable remedy before those disorganizations take place, then these latter would not come to be developed, and it would be an inexcusable procedure to allow these sufferings to advance to a point where these material changes can be recognized in an artificial manner. Okay, so when we have a patient who, through an investigation of the blood, finds out that there's something a little bit off, this is what he's talking about, even though they didn't have that there. Medicine during his time period, Bönninghausen's time period, they had come up with a way to test for sugar in the urine. And there's an interesting essay written on that, which is a lot of fun. Okay, so yeah, we want to treat people before any kind of really deep pathology happens. And now we're going to go to infectious disease. Okay, so we want to, okay, it was necessary to mention this in passing in order that it may be shown how homeopathy precedes, and to deny most decidedly the objection sometimes made that homeopathy is merely an expective method, which allows the disease to develop without hindrance until it is too late to help. So yeah, we can get things in the early stages when we treat deeply. On the contrary, homeopathy knows and uses in infectious diseases sure prophylactic remedies, which are always and exclusively such as have the power to heal the disease itself, and they never omit their use for the protection of those around the patient. Okay, so then he's talking about homeoprophylaxis there. And elsewhere, there's some very interesting information about that. Okay, now we're at the Quibus auxilius. So this is the
Quibus auxiliis.
Yep, these are the concomitants. Because okay, because Bönninghausen says that it should be the Quibus socius or Quibus concomitans. So socius would be, like socializing. Concomitans would be like combinations. Okay, if the hexameter, which we are following, had been originally written for our doctrine of homeopathy, probably a more suitable expression would have been used in the instance. For example, quibus socius or quibus convitius, which are the companions that come along with the main complaint. Okay, so these are going to be the companion symptoms,
What does it mean?
the concomitants.
As concomitants.
Mhm.
Means symptoms which are associated with the main disease or disease symptoms. Right?
Right.
Radhika, what is the definition of concomitants?
A symptom which comes along with or just after or just before or during or just after the course of the main symptom, and it is not it is in no way directly related to the to the current symptom. I mean, it's
Okay.
from a different system altogether.
Any examples?
Asthma with pain in the leg. I'm just giving a random example.
Can you give some examples?
Well, yeah, I could give an interesting example because this is one of my favorite examples. Okay, let's say somebody has vomiting. Okay, so that's one symptom. Let's say that there is vomiting with diarrhea at the same time. That gives a concomitant, and that will lead us to either, my mind is totally gone blank, arsenicum, okay, arsenicum or veratrum. If there is cold sweat on the forehead, we know for sure that we can exclude arsenicum and we can give veratrum. So these are concomitants that can go along with vomiting. And that's just a simple example.
Even
Okay.
abrotanum has many concomitants. Abrotanum. Don't remember, but abrotanum also has something with something. I mean, two or three different symptoms coming together. Yeah. I'm just checking. Yeah, gastric and rheumatic concomitants are there.
Yes,
Abrotanum.
good, very good.
Okay. Continue.
Now, since in homeopathy, the chief aim consists in ascertaining the remedy which most completely corresponds to the totality of the symptoms. He doesn't mean random symptoms or vague symptoms. He means clear, concrete symptoms. It is evident that this point is of the greatest importance and deserves the most careful consideration. Okay, so the concomitants in any disease, if they are there, deserve careful consideration, and they are very important. Now he gives us a nice little thing about the recognizable phenomena. Does anybody want to read this paragraph?
Radhika?
Yes, I can read it. For every disease presents in its recognizable phenomena a more or less numerous group of symptoms, and it is only their totality which presents its complete image. This image may be compared to a portrait, which can only then claim to be a striking likeness when all the features of the original are faithfully presented in it. It is not sufficient that mouth, nose, eyes, ears, etc. should be presented in such a manner as characterizes man and distinguishes him from the monkey and other animals. But as every human physiognomy possesses its peculiarities and is distinguished from every other, so also here the more or less strongly pronounced abnormalities must most carefully and with the greatest faithfulness and truthfulness be presented and given their prominence. If therefore, retaining our former comparison, the nose should have a most peculiar form, color, or size, it would not be sufficient to present this alone, though it should be most lifelike and to add all the rest according to fancy, but also the secondary parts, which, as it were, form the background, must present a whole such as it exists in reality, in order to give a perfect likeness.
Likeliness.
Beautiful. Yeah. So, okay, all of us have noses, right?
Mhm.
But my nose is different than your nose. So it's not enough to say there is a nose. We have to make the nose to be the nose that it belongs to that person. And the same thing when we're trying to ascertain the symptoms or the momentum of the disease. We need to find out how exactly it presents in the individual. It is from this point of view that the concomitant ailments are to be regarded when we select a remedy according to the motto, similia similibus. Thence it is evident that the rare, striking, and peculiar symptoms which present themselves demand a more prominent place than the common ones, because on them chiefly, though not exclusively, the similitude depends. We are looking for what's characteristic about the individual's nose, right? From this, it naturally follows that the value of such concomitant symptoms for the purpose intended varies widely. But it would be too far transcend the purpose of this contribution if I should adduce and explain all the many categories of value. I shall therefore limit myself to the presentation of a few of the most important points here involved. What are those points, Sanjay?
Hmm?
Well, this is your turn.
Okay.
First of all, those symptoms which are found in almost all diseases may be left out of our count unless they manifest themselves in a striking manner.
In some obtained as to those elements which are wont to appear as constant concomitant or at least as usual in the disease under consideration, unless they should be distinguished by some rare peculiarity, and in this respect offering something characteritis. On other hand, I have this. All those attendant symptoms should be carefully noted, which he has explained these 3 points. Rarely appears in connection with the leading disease and are therefore also found rarely among with the provings. Second, those which belongs to another pair of disease than the chief complaints. He has mentioned how these concomitant uh, are associated. We need to recognize whether they are associated with the main complaints, whether they are associated with the rest of minor symptoms. And even though from this, he told that all concomitant symptoms are very important and should be considered at priority. those which belongs to another space of disease, then the chief complaints, and lastly, those which have more or less characteristic signs of one of the medicines, even in case they have not before been noticed in the present juxtaposition. How to pronounce that word?
Juxtaposition.
Juxtaposition.
It means like in relationship to.
Yeah. Now, if beside this, among the last mentioned concomitant symptoms, there should be one or another in which the genus of one of the remedies should be plainly and definitely portrayed. So that it could be a plainly pointed out this one symptom hereby could acquire such a importance that it could even outweigh those of the chief ailments, and many then be at once considered at the most suitable. Such a symptom could be included among those which the Hahnemann calls striking, strange, unusual, and peculiar characteristic signs, and which are then almost alone to be considered because they preeminently give to the whole disease its individual characters. Right?
Right. When such a symptom would be included among those which Hahnemann calls striking, strange, unusual, and peculiar characteristic signs, and which are then almost alone to be considered. He says almost, not completely. Therefore, the keynote prescription is thrown out the window because it really has to match up with other things in the remedy and be logical. Yeah, because even if we are going to prescribe on a keynote, it has to make sense.
Yeah.
That's why he says almost. Because they preeminently give to the whole disease its individual character. Yeah, so if we have somebody who thinks they're a deity, we're going to throw out a whole bunch of remedies from our observation because not many remedies have that delusion that they're a deity. Would you like to continue reading, Sandra? That'd be so lovely.
Radhika? From one
I asked you,
circumstances.
Sandra. I asked you.
Shall I read?
You want me to read?
Yes, yes, please.
Okay.
I cannot read long because might cough.
Yeah, my throat feels weird too. You're not the only one. One circumstance.
You want me again?
Do you mind?
No, actually, I am. It's irritated when I talk or try to read aloud.
Did I ever say it was easy for me to read page after page after page after page of this stuff and explain it at the same time? Did I ever say that was easy?
We are discussing.
Okay. One circumstance deserves to be particularly mentioned here, which particularly shows the importance and value of concomitant symptoms, namely that several very efficient and in our part specific remedies in certain diseases were discovered almost exclusively through them. So we have here some very interesting information. The other symptoms indicating the main disease not having pointed in that direction. Okay, so he's saying here, one circumstance deserves to be particularly mentioned here, which particularly shows the importance and value of concomitant symptoms, namely that several very efficient and in part specific remedies in certain diseases were discovered almost exclusively through them. For example, he gave us the example of sepia with the ulcers on the backs of the finger and toe joints. The other symptoms indicating the main disease have not pointed in that direction, nor indeed could they have given such an indication, because the noticeable proximate signs could not sufficiently indicate the real peculiarity of the disease. Is he
What-
saying here, is he saying that sometimes an auxiliary symptom that is not the main complaint might have tremendous value? Is that what he's saying here?
I think he's saying that the main complaints of the disease state and the other concomitant symptom may not related to each other. Is it the same?
One circum-
Suppose he's having a pain in suppose this liver region, right? And disease state in the liver region. Pain in liver region always associated with pain in joint, left joint, or finger joints, whatever you can consider. Because this liver, digestive system, and this locomotor system are not directly connected, but they may present or give symptoms in the particular individual. Is it the same? That what I am asking.
No, that's what we're trying to ascertain here. One circumstance deserves to be particularly mentioned here, which particularly shows the importance and value of concomitant symptoms, namely that several very efficient and in part specific remedies in certain diseases were discovered almost exclusively through them. The other symptoms indicating the main disease not having pointed in that direction. So yes, he is saying that the concomitants have indicated remedies in sick people and not the main complaint. So sometimes it's the concomitant that gives us our selection of remedies, of remedy, and not just the main complaint. So it's not always about the main complaint, because the concomitant can have more value, indicating the main disease, okay, have not pointed in that direction. So the main complaint, he's saying in situations that the main complaint has not pointed to the direction of a certain remedy, and that the concomitant had come in and furnished the most important decisive factor in which remedy to choose.
And
Okay, so
further ahead they have given, because of noticeable proximate signs could not sufficiently indicate the real peculiarity of the disease.
Does it mean that when we are not able to find the characteristic symptoms close to the main symptom in that particular area, then the concomitant can indicate or give us the characteristic symptom?
Yeah, he says that it's possible that it can. And sometimes the case is so lame that we just simply have to draw that portrait and come up with the best we can.
Mhm.
That happens too. Because not everything, it really depends. Okay, the same system of concomitant symptoms also gives to homeopathy a much greater sureness in the treatment of diseases as compared with
Compared
allopathy,
to allopathy.
which first constructs for itself a frequently deceptive diagnosis of the disease, which at most only points out the genus of a disease, and where there are no important attending symptoms, it endeavors to help itself by adding to a leading remedy only for the genus of the disease, one or another additional remedies to cover the concomitant ailments. Okay, so he's saying that allopathy does something deceptive, that they make a diagnosis first. Because as a homeopath, we make the diagnosis is the same thing as the remedy. You got that concept there, that the diagnosis is one and the same with the remedy that is going to cover symptoms the best. Because we're not particularly concerned with the allopathic diagnosis. We are concerned with the
Diagnosis
momenta
of
of the
remedy.
disease. Yeah, because Bönninghausen says elsewhere that the diagnosis of the disease and the diagnosis of the treatment are one and the same.
Yeah, diagnosis of the disease and diagnosis of treatment or remedy, you can say.
This is the same thing because we are looking for the similitude of the symptoms produced by the vital force to match that with the symptoms produced in a healthy person by a substance during a proving. Right, guys?
Yeah.
So he says that the frequently deceptive diagnosis of disease doesn't help us very much. And that, yes, sometimes the concomitant will take priority over the main complaint. It does happen occasionally when we are sitting with somebody and they are complaining about X, Y, and Z, but we see A, B, and C. And we want to see that we need to treat A, B, and C, even though X, Y, and Z is important to the person. It might be that what needs to be treated is A, B, and C. Okay, have we been here for an hour?
We have only 15 minutes. So shall we continue with the cure?
Or why? Why?
Shall we continue or shall we stop?
Should we go a little further? Because we won't be able to finish Kerr until next week. It's gonna take us,
Okay.
should we
How big,
continue?
cure is very large.
Yes, it is. Kerr is
Yeah,
very large.
almost 2 pages of this book.
Yeah, we could start it, or we could wait until next week. What's the consensus?
Hmm?
What's the consensus?
It's almost 3 pages, 3 pages.
Mhm.
It will not finish, or it will take another half an hour. It's fine for me. What do you say?
Did- Radhika?
Radhika? Network.
Devera? Hello, Devera.
Devera?
Okay, well, I'm just gonna start the first paragraph of core.
I
Why?
am here. I'm
Oh, you're
here. I'm
here?
here.
Okay, is it okay with you if we just go partly into core?
Fine with me. Yes.
Okay, I'm just gonna go part way because it's a few pages.
Okay.
Okay, number 5. Core. Why? The causes of the disease play a prominent part in pathological books, and justly. But a large part of this amounts only to guesses and attempts at explanation, which mostly have only a very subordinate value or none at all in the proper therapy of the disease, and which are too remote for our doctrine, which is directed merely to the practical. Okay, so we could even talk about this paragraph. This paragraph is really good and meaty. Okay, the causes of disease play a prominent part in pathology books, as it should be. But a large part of this amounts only to guesses and attempts at explanation, which mostly have only a very subordinate value or no value at all in the proper therapy of the disease, and which are too remote for our doctrine, which is directed merely to the practical. Okay, so Bönninghausen is reminding us here that to be a homeopath, you have to be practical and you have to have concrete symptoms. And while there are people who study pathology, and that's a good thing, that doesn't help us with what remedies we are going to need for our patient per se. Because as we know as homeopaths, it matters not the name of the disease. It matters not what the pathogen is. It really doesn't. Because, well, we could take, for example, our current situation with the coronavirus. Okay, everybody got scared that there was a new virus. And what are we going to do? And how are we going to treat it? What's going to be? Oh no, we're scared. We're going to leave this to the allopaths. We're going to leave this to the pathologists to figure out. But really, what we need to do as homeopaths is ignore the name. Now, I think everybody's gotten over the word coronavirus by now, 2 years in, and everybody's able to say, okay, yeah, fever-causing virus, and get on with our work. So the pathology doesn't furnish very much information, and the disease symptoms themselves furnish the information that we need as homeopaths, because pathology is largely guesses and attempts at explanations. You know, they get out the electron microscope and they look at the things that they have on their slides and they say X, Y, Z, and then they make some mathematical calculations and say, well, I think this and I think that. But all we need to do as homeopaths is to get into the meat of the matter, get into the root of the disease, and ascertain those pure symptoms, match them with the symptoms that are in our provings that correspond best with the disease state of the person. So therefore, the pathology of whether it's a staph infection or a strep infection, or whether or not it's Omicron virus or Delta plus or Alpha original, doesn't matter to us as homeopaths, because our treatment is guided by the signs and symptoms displayed by the vital force itself. I
Yeah.
am done. I am done.
Fantastic.
And then we get into a whole bunch of meat in the matter here about the natural disposition, the idiosyncrasies, and the chronic diseases, and spora and latent spora, and all kinds of different stuff like that as we are in Kur, because that is important. But it is a long topic, and we want these videos to be watchable. Anybody want to sum up any closing remarks? Are we done? We don't hear you, Sanjay. You don't have any noise.
It's long topic to continue now. We can continue this next week. Probably next week we might finish, or one more week might need to complete this characteritis symptoms.
Oh, no, it's going to take 2 weeks. It's going to take 2 weeks.
Yeah,
2 more weeks.
but it's really, really very important. And every homeopath should understand this part of Bönninghausen.
Just wait till we come to his essay on motion and rest. Good times.
Yeah.
Actually, it's very enlightening on motion and rest. I like that one a lot.
Devira has anything to say? Devira,
Yes, I'm sorry.
do you have
I didn't
anything
hear
to say on the today's class?
On today, I don't have anything to add. I just want to thank you guys again, as always. And I always learn every time something new, and I very much appreciate it.
Yeah.
Yeah, thank you, Devera. Thank you for your support.
Thank you.
Okay, so yeah, we'll continue B'ezrat Hashem next week.
Yeah. Thank you all.
Bye-bye.